talked about obesity for a long time as being a pandemic in North America, for sure, but it's becoming more of a global issue. There's certainly a higher prevalence of obesity, and the projections suggest that it will continue to increase. But now I think people are starting to really look at it differently. What people used to think when they see somebody who has obesity or who is overweight, you automatically assume that that's a lifestyle choice. Recent scientific findings defining obesity as a disease and not necessarily a lifestyle choice hopefully changes the minds and perception of society and how this disease needs to be treated and handled. One of the exciting things about this space of anti-obesity medications is that we're really seeing a boon of a number of companies, large and small, developing drugs for chronic weight management, like Ozempic and Mounjaro and Zepbound and Wegovy. And these are really the GLP-1 drugs that have really shown for the first time 10, 15, 20% of weight loss in patients that really need it. That's an exciting time for the obesity medication space. People think that, okay, well, now we have these drugs and that's all we're going to need. And unfortunately, that's not true. Although the GLP-1 based drugs are really effective, I think what we have to understand first and foremost is obesity truly is a heterogeneous disease, which means that not every person that has obesity is going to react the same, and they're not going to necessarily require the same treatment. When we speak to KOLs or key opinion leaders and doctors who are seeing these patients for the first time or seeing these patients multiple times, hundreds of these patients at a time, their comment to us is that they need new therapies. They love the GLP-1s, but they need something else because there are going to be patients that those GLP-1s just don't work on. They may not lose that 10 or 15% of weight. Or sometimes those drugs really are not that tolerable. Some of these patients really can't handle that drug, so they'll never achieve that weight loss because they have some significant side effects. What the KOLs are telling us today is they need other mechanisms of drugs, not just GLP-1s, that they can use. Most patients need, 5, 10, 12% weight loss. That's sort of the sweet spot of range where you're going to see an improvement in quality of life, improvement in other metabolic conditions that are really important to the patient's broader health. So where nimacimab fits into that is truly the fact that it is a separate mechanism of action compared to GLP-1s. And when we speak to doctors, they think it really has an opportunity as a second line or even a post-treatment opportunity to go after GLP-1s.